Let's talk about the types of angina pectoris today. Angina pectoris is also known as angina, where what happens, a person has squeezing, pressure, heaviness, tightness, or pain in the chest. So, to define angina, it is a type of chest pain which is caused by reduced blood flow to the heart. We know that heart is been supplied by coronary arteries. So, because of any reason, if the coronary arteries are not able to supply proper blood to the heart, there might be chest pain, which is known as angina. When we talk about the types of angina, broadly we can classify the angina into three main types, that is stable angina, unstable angina, and variant angina. Stable angina is also known as classic angina. Unstable is also known as crescendo angina, and variant angina is also known as Prince metal angina. Let's talk about them one by one, starting from the stable angina. So basically, in the stable angina, what happens? The coronary arteries are obstructed because of the atheromas, which is also known as plaque. So because of the deposition of cholesterol, what happens? The coronary arteries are blocked, and because of which the coronary arteries are not able to supply enough blood to the heart. Also, the person has stable angina when they are doing some exertional activities, such as when they are exercising or when they are climbing the stairs. Why? Because during those activities, the heart will be the myocardium needs to work harder. The heart needs to work harder, but actually, because of the obstruction of coronary arteries, the blood vessels are not able to supply proper oxygen nutrition to the myocardium. So there is a problem in the supply and demand, and because of which the person has the chest pain. It has been seen that a pain in the stable angina lasts for a short period of time, and perhaps it usually lasts within 5 minutes or less. And if a person is taking rest, the pain might disappear, and also the pain might disappear if a person is taking the angina medication. So, what are the characteristics of stable angina? It occurs because of the obstruction of coronary arteries. It occurs when the person is doing certain kind of exertional activities. It is usually it occurs in a very short period of time, and it disappears when a person takes the rest or when the person takes angina medication. The examples of angina medications can be nitrates. Sorbitrate is one of the common medication what we use for the treatment of chest pain. Then, if a person has unstable angina, which is also known as crescendo angina, इसमें क्या होता है? It might occur because of the spasm and partial obstruction of the coronary arteries. So, coronary arteries में obstruction है, किसकी वजह से? कोलेस्ट्रॉल की वजह से, और साथ में coronary arteries में spasm भी हो रहा है, which can cause the unstable type of angina. This might be quite unexpected, and even a person who is at rest may have the unstable angina. And usually, it has been seen that it is more severe as compared to your stable angina, and it lasts longer than the stable angina. Even it may last long, it may be for more than 30 minutes also. And also, just with the help of rest, the patient's pain might not disappear. And even with the use of anti-anginal medications, the patient's pain might not disappear. So, this is something which is more severe in nature as compared to the stable angina. The third type of angina is variant angina. It is also known as Prince metal angina. Why it is known as Prince metal angina? Because in the year 1959, Dr. Biron Prince Metal described this kind of angina. What he described was that कि patient को chest pain जो है वो सिर्फ एथ्रोमा की वजह से या फिर plaque formation की वजह से ही नहीं होता है. Even if it can be there, if there is spasm of the coronary arteries, जब coronary arteries spastic हो जाती है या वहां पे spasm हो जाता है, this can also lead to the chest pain, which is known as variant angina. And the usual cause of having the spasm inside the arteries can be attributable to smoking, or it can be attributable to the patients who have congenital heart disorders, etc. And इसमें क्या होता है, it might be even present irrespective of the exertion. The person is sleeping, the person is at rest, still the person might have the variant angina. These are the three main important types of angina. Apart from them, there can be other types of angina also. Like we can have nocturnal angina. अगर angina या chest pain सोते समय होता है, if a person has the chest pain while sleeping, it is known as nocturnal angina. Then we have another one, which is angina decubitus. Angina decubitus means if a person is lying down, he has the chest pain. Okay, so irrespective of whether it is daytime or nighttime, when a person is lying down because of change in the gravity, which leads to redistribution of the fluids inside the body, the person might be having the angina decubitus. Then we have intractable angina. Intractable angina is also known as refractory angina. It means the person is on anti-anginal medication regimen. Still, after being adherent to the anti-angina medications also, the person still has chest pain, that is intractable or refractory angina. Then we have post-infarction angina. इसमें क्या होता है? The person already had myocardial infarction, and after say 24 hours or even slightly more than that, he had one more episode of chest pain. So that is known as पोस्ट इन्फाक्शन एंजाइना, वो एंजाइना जो इन्फाक्शन होने के, मायोकार्डियल इन्फाक्शन होने के बाद में भी पेशेंट को हुआ. And then we have one more type, which is known as microvascular angina. So previously, microvascular angina was known as cardiac syndrome X. Now it is more commonly known as microvascular angina. इसमें क्या होता है? It is like the person will not be having problem in the major coronary arteries, but the micro vessels, very small, very smallest of the vessels, even less than 5 or less than 0.5 mm, can be like they can be affected with this kind of angina. So if smallest arteries are involved, which is known as microvascular angina. So today we discussed about different types of angina, where we may have stable angina, also known as classic angina, जहाँ पे patient की coronary arteries में obstruction हो जाती है because of plaque formation, and the patient has pain when he is doing certain kind of exertional activities. Then we have unstable angina, when the person has pain even at rest, and the pain is longer duration as compared to the stable angina. Then we have variant angina, which is also known as prinzmental angina, which is irrespective of the person has like atherosclerosis or atrauma, the person has spasm of the coronary arteries leading to the variant angina. तो देखा गया है कि variant angina में patient को spasm होता है, उसके साथ साथ में the person might be having the atrauma formation also. Then we have nocturnal angina, angina decubitus, intractable angina, post-infarction angina, and microvascular angina. So that's it for today. Thank you so much. Before leaving, I'll give you one more question to find out. You have to find out, why do we call unstable angina as crescendo angina also? ठीक है, crescendo angina भी हम कहते हैं unstable angina को. So why do we do that? That is your assignment. You have to find it out and write in the comment box. Thank you so much.